This recording will go over sialadenitis and salivary gland tumors. Acute sialadenitis, the inflammation of a salivary gland, can be caused by infectious agents, irradiation, or immunologic disorders. A decrease in the production of saliva, as in dehydrated or debilitated patients or in those who are on NPO status after surgery for an extended time, can lead to acute sialadenitis. The bacteria or viruses enter the gland through the ductal opening in the mouth. Systemic drugs, such as phenothiazines and the tetracyclines, can also trigger an episode of acute sialadenitis. Untreated infections of the salivary glands can evolve into abscesses, which can rupture and spread infection into the tissue of the neck and mediastinum. Patients who receive radiation for treatment of cancers of the head and neck or thyroid may develop decreased salivary flow, predisposing them to acute or persistent sialadenitis. The effect of radiation on the salivary glands is rapid and dose-related. Immunologic disorders such as HIV infection can cause enlargement of the parotid gland that results from secondary infection. Sjogren's syndrome, an autoimmune disorder, is characterized by chronic salivary gland enlargement and inflammation that causes very dry mouth. When caring for the patient, assess for any predisposing factors for sialadenitis, such as ionizing radiation to the head or neck areas. Collect a thorough drug history and ask about systemic illnesses such as HIV. Dehydration can be assessed by examining the oral membrane for dryness and the skin for turgor. Other assessment findings include pain and swelling of the face over the affected gland. Assess facial function because the branches of cranial nerve 7, the facial nerve, lie close to the salivary glands. Fever and general malaise also occur, and purulent drainage can often be massaged from the affected duct in the oral cavity. Collaborative care includes the administration of IV fluids and measures such as these to treat underlying causes and increase the flow of saliva. These measures include hydration, application of warm compresses, massage of the gland, use of saliva substitute, and use of sialogs. Sialagogues, including lemon slices and citrus and other fruit-flavored candy, can stimulate the secretion of saliva. Massage is accomplished by milking the edematous gland with the fingertips toward the ductal opening. Elevation of the head of the bed promotes gravity drainage of the edematous gland. Acute sialadenitis is best prevented by adherence to routine oral hygiene. This practice prevents infection from ascending to the salivary glands from the mouth. The salivary glands are sensitive to ionizing radiation. Exposure of the glands to radiation produces a type of sialadenitis known as xerostomia, or very dry mouth caused by severe reduction in the flow of saliva. Xerostomia may be temporary or permanent depending on the dose of radiation and the percentage of total salivary gland tissue irradiated. Little can be done to relieve the patient's dry mouth during the course of radiation therapy. Frequent sips of water and frequent mouth care, especially before meals, are the most effective interventions. After the course of radiation therapy is completed, saliva substitutes may provide moisture for 2 to 4 hours at a time. Over-the-counter solutions are available. Of all oral tumors, those of the salivary glands are relatively rare. Tumor invasion of the hypoglossal nerve causes impairment movement of the tongue, and a loss of sensation can follow. Pay particular attention to assessment of the facial nerve because of its proximity to the salivary glands. Assess the patient's ability to wrinkle the brow, raise the eyebrows, squeeze and hold the eyes shut, wrinkle the nose, pucker lips, puff out cheeks, and grimace or smile. Beware of any asymmetry when the patient performs these motions. Patients who undergo surgical removal of the parotid glands or submandibular gland surgery are at risk for weakness or loss of function of the facial nerve because the nerve courses directly through the gland. Facial nerve repair with grafting can be done at the time of surgery.